Hey everybody, welcome back to OrthoNugs. In this video, I'll be demonstrating some manual techniques to correct pelvic ring or sacroiliac joint dysfunction. And specifically, we're going to be going through some manual techniques to correct a posteriorly displaced innominate. All right, all the techniques in this video are intended to create an anterior moment or torque of the right innominate. Remember, we're correcting a posteriorly displaced innominate. So I like this position of the hip. We're putting the hip in the closed pack position, extending, abducting, and internally rotating. That locks out the hip joint, so more of this distraction force will be distributed through the innominate. I also like this position because it pre-tensions the anterior soft tissues of the hip, which creates more of that anterior moment. You can see there's a grade 5 HVLA technique there. Now we're onto a side lying position. So I'm going to pre-position the right hip into extension. Again, tensioning the anterior soft tissue structures of the hip, which creates an anterior moment on that right innominate. Notice my hand placement. My left hand is over PSIS. My right hand is over the anterior hip. My forearms are parallel, so I can use bigger muscles to generate that rotational force. Trying to rotate with an oscillatory mobilization, that innominate in an anterior direction. This last technique is, of course, in a prone position. So we're going to use the femur as a lever, tensioning the anterior structures of the hip. Then I'm going to put my right hand over the PSIS with an anteriorly directed oscillatory mobilization in order to create that anterior innominate torque. Thanks so much for watching. If you feel the content of this video was helpful and informative, please consider subscribing to our OrthoNugs channel. I've also included a few links here to some other videos that you should definitely check out. Thanks again for watching.